And now, here's Danny Darrow sitting in for Josiane. Hi, I'm Danny Darrow, and I'd like to welcome you to a special edition of the Josiane Show, Persons of Interest. Today we have with us a very special guest, Dr. Kevin Endy, who is a teacher of other doctors in advanced and surgical techniques in reconstructive surgery, such as facial plastic, hair transplant, lip surgery, scalp surgery, wound healing from the head down to the neck. So if you had any facial accidents, head accidents, deformities from the neck up where you were disfigured in any way, here is your doctor. He is a double board certified Phi Beta Kappa on America's top surgeons list from 2007 to 2012. He is very compassionate and very wonderful and has performed over 7,500 surgical procedures and is in New York City. I'd like to now welcome you to the wonderful and compassionate Dr. Kevin Endy. Dr. Endy, you have helped thousands of people in the New York area. Why don't you tell us a little bit about that?
Sure, Danny. Well, first of all, thank you for inviting me on the show to speak with you.
Well, thank you for being here.
Absolutely. As you stated, I do have a lot of experience taking care of patients who have required reconstructions on the face and the scalp. I know we have a limited amount of time to talk about different examples of this kind of work.
Well, with your bio, my God, you've got tons and tons of bio. I mean, we're going to try to cram everything in like 28 minutes. So don't let me stop you. Keep going.
Sounds good. Well, you know, we can focus on certain areas. Certainly, we can start with one example. I can show you a picture here of someone who might have had some trauma to the scalp area. You can see basically a balding area right here. This could be an example of someone who had a chemical burn to the area,
or a cancer thing, or a surgery from the brain and stuff like that,
right,
where the hair actually did not grow back.
Sure, it can happen from that, or really any kind of trauma can cause something like this. Sometimes the hair will grow back, sometimes it doesn't, and that's where I get involved.
All right.
So,
but this is the super topper of after surgery,
right,
and just to make people look really wonderful and look great and feel great.
Right.
Yeah. All right. Tell us a little bit more.
So this could be approached in several different ways, but the way that I chose to deal with this particular situation was to use follicular unit hair transplantation.
Yeah, and I don't know what that. Oh, follicular. That's hair.
Exactly.
Okay.
So, we call it follicular unit hair transplantation because it's not the old way of doing it with plugs. Plugs used to be 10, 20 hairs in clumps, and they would be put into the areas where the patient was balding. And it would look like doll's hair when it grew out. It certainly, covered the area, but it just didn't look very good.
Now, I have to ask you a question. Now, where do you get this hair from? Do you get it from other people, from other people's hair, or do you get it right from the patient's hair itself?
Well, most of the time we're going to get it right from the patient's scalp. As long as they have enough hair on the back of their head or on the sides of their head that we can take without anybody noticing, that's what we use. There have been examples in the past where people have used donor hair, but that's more for patients who may have had a bone marrow transplant. So they already knew they were a match for the donor, so they also took their hair.
Yeah, but how do you know if the hair is if it's the exact same color, if it's is there a difference between the hair itself from one person to the other person where the hair doesn't grow back or does grow back? How does that work?
Well, if you were to take it from a donor hair, there's not a lot of experience with that in the literature. I really don't have any personal experience with it. However, these are things that people write about because there are possibilities. Most people would not use a donor hair because it's just like any other transplant, whether it's a kidney transplant, liver transplant. You have to be on medication for the rest of your life if you receive a transplant from somebody else.
That's right, yeah.
So for cosmetic purposes, maybe it's not so much worth it to be on a medication the rest of your life.
Yeah, all right. Well, now, does this hair grow back where it becomes perfectly normal? Like when I go and I take a haircut and the hair grows back in about a month, I have to take another haircut?
Right.
Is that going to work similarly to a patient that has brain surgery and stuff like that? I mean, does that happen like that?
There's a lot of different situations where hair transplant can be used. The hair doesn't start growing immediately. The hair has a cycle to it. The hair cycle is 3 months. So what we do is, for follicular unit hair transplantation, we harvest the hair from the back of the head. It's taken out usually as a strip, or there's other methods to remove it as well. Those hairs are cut into individual follicular units. So to describe what that is, it's not a clump of hair like the old plugs, it's also not individual hairs. The hair occurs in natural groupings of anywhere from 1, 2, or 3 hairs. The average number of hairs in each grouping is 2.2. So we keep the hair as it naturally occurs before we put it back in, so that when it actually grows in, it's going to grow back in like normal hair. After the procedure, there's 2 parts to the hair. There's the hair follicle and there's the hair bulb. After about a week, the hair follicle falls out, whereas the bulb stays underneath the scalp, and it looks like I didn't even do anything. So the person walks around looking exactly the same as they did before.
Well, that's wonderful. Well,
But
that gives the patient a lot of confidence and a lot of, like he never had the operation to begin with.
They wonder why they went through the procedure.
That's right. Wow.
But of course, we talk about ahead of time that the hair has a cycle to it, so that at 3 months, those hairs start coming in, and they come in like normal hair. And over time, they get longer, and of course, and they get thicker. And typically, by about a year, that's when the hair will be its final thickness, and it's usually a few inches long.
Yeah.
So
and then it's normal. It never falls out again or anything.
Well, the theory is like donor dominance. That's what we call it. So if we take a hair from a part of your body, let's say the back of your head, where you were never going to lose it in the first place, I can put that hair anywhere else on your body, and it's going to grow like it would have from the place I took it from.
Really?
Yeah, absolutely.
Wow, that's amazing.
So
that's amazing.
To show you an example of that particular patient.
All right, let's see.
This would be after 1 follicular unit hair transplant session to the balding area.
Yeah, can the control room pick that up? Can we pick that up? Maybe on the other camera?
There we go. We can turn it like this.
Maybe a little more, Dr. Endy? Yeah, just about like that.
Okay.
And there you go.
So that's after 1 follicular unit hair transplantation to that area.
Yeah.
And then I have another example of a second procedure on the same patient in order to get the best result in that area. When an area is completely bald like that, it does typically take 2 hair transplant sessions to get a result like this.
Yeah.
However, if it's just thinning hair, it can usually be done in just 1 session.
Yeah. Very interesting. Well, let me ask you something. You know, when patients, you know, have these traumas and these surgeries and the scars all over and everything else, and if they have the insurance picks all that up, I think. Will insurance cover this, or how would they pay for a thing like this?
Insurance does cover some types of trauma to the head, and especially if it was due to either surgical trauma, or any type of accidents and things like that. You can get your insurance company, depending on which company it is and how they define everything, to cover either all of it or part of it a lot of times. So some of these reconstructive procedures are covered.
Oh, that's wonderful. That's wonderful. Now, you've also done lip surgery, you've done eye surgery, and you have a lot of advanced techniques that you teach a lot of other doctors and everything else, which is absolutely wonderful. Can you tell us a little bit about that?
Sure. Well, you mentioned lip surgery first, so why don't we focus on that?
Okay.
You know, it seems like we're trying to focus on traumas with the limited amount of time that we have on the show. So think about a person who has a scar on the upper lip, or maybe they had a cleft lip that they were born with and they had that reconstructed.
All right.
There's a lot of different things that can happen to an upper lip that somebody would want to disguise.
Yeah.
So a popular thing to do is to transplant a mustache. And
oh, for God's sakes, I never thought of that.
Yeah, most people would say, well, why would you want to get a mustache transplanted? Who would actually go and do that procedure?
Yeah.
But it's certainly very useful in people who have visible scars in that area.
Yeah.
Because if you have hair that's transplanted over that scar, it may be the best way to disguise it. If it's a wide scar, the scar can be revised before doing the hair. But if it's a fine line scar that someone is self-conscious about and they want to take care of it so that nobody else can see it, a hair transplant to the mustache area is a great thing.
Oh, that's really something.
Of course, we're talking about our male patients here.
Oh, the male, well, the women don't. No, some of the women are walking around in New York City and they have mustaches on all over.
They must have gone to somebody else.
All right, let me ask you something. Do these scars eventually go away where maybe people don't want to have a mustache?
Right.
And how would you treat that?
Sure. Well, depending on the types of scars, if it's a widened scar, you can use a scar revision surgery to take care of that. There are different flap techniques or just excision techniques that sometimes only take a few minutes to take care of.
Yeah.
If it's already a fine line scar and it's maybe a little bit raised, we have different lasers that we can use to resurface the area. to get it to smooth out. So those are two of the most popular ways to take care of it. Some of the older ways would be to use chemical peels on the area, and that's still acceptable. A lot of patients choose to do it that way, just resurface the area so that everything appears to be the same surface, everything is smoothed out.
Yeah, that's interesting. Now, how about the eyes, the hanging eye thing and stuff? Because a lot of people are walking around New York City and the eye is hanging, and the lip is hanging, and all kinds of stuff. How would you treat that?
Well, it depends on the specific example that you're talking about, but there are actually a lot of traumas that happen around the eyes. Actually, just since we were talking about hair, I did bring another picture of what might be an example of
I'd
trauma.
like to see that.
Let me get that out for us here. So, if we can take a look at this photo here, we can see an area.
Yeah, you can, Dr. Endy, can you straighten that a little bit so the camera swing around this way? There you go. And that's fine. Yeah, that's wonderful.
So on the top part of the eyelid there, you can see an area where there's really no eyelashes. And these things happen from either cancers or traumas or there's a few different reasons why someone might be missing eyelashes in an area on the upper eyelid there.
Yeah.
So, there's a couple of ways to take care of that. You could do a scar revision surgery like I mentioned before, or you can just put hair transplants right into that traumatized area on the upper eyelid to help disguise that.
Yeah, but then of course you'd have to match up one side to the other side, and make the woman look absolutely beautiful.
Well, there is some artistry that goes into this. Okay. It's not just as simple as taking hairs from one place and putting them in the other.
Yeah, all right.
There's certainly a lot of different things that go into it. We have to talk about the angle of the hair, the density of the hair, the curl of the hair, not putting each hair in the same direction. And we also, I can show you the after effects of having a hair transplant to that area. If we
can we get a shot of that from the control room, please?
You can see if the hair is put in the exact correct angle and in the same direction as the surrounding hairs or in the same direction as it should be, you really can't even tell that this individual had a hair transplant to that traumatized area.
Yeah, isn't that something? Now, the hair transplant was exactly where?
Well, we can go back to the other photo.
Yeah.
And let's see here, if we can just see this white area right here where there's missing hair. So, that could be, like I said, an area that was right here.
I see it,
traumatized. It's just basically a gap from this area here where there's hair. And you see no hair, and then you've got your eyelashes again.
Oh, wow. And then of course, you put everything in perfectly, and then it just stays there forever like that. It never changes?
No, like I said, actually, it falls out, and it looks like I didn't do anything after about a week.
Oh.
And then 3 months later, those hairs actually start growing back in. And the interesting thing about the eyelashes or the eyebrows is the hair keeps growing, so it does require some maintenance. You do have to trim it every week or so. In order to keep it the same length as the other ones.
Yeah, well, women do that anyways with their tweezers and and a lot of people use false eyelashes.
Right.
So really, wait a minute. Speaking about false eyelashes, they won't need false eyelashes if they call you.
Absolutely.
That's right, because you can put all those eyelashes in and they stay there permanently.
And most people don't realize that the eyelashes can be transplanted. Most of us have heard that the hair on the top of the head can be transplanted, but we don't realize that really anywhere on the face can be transplanted if necessary.
Well, that's absolutely amazing. That's really something. Good. Tell us about some of the other surgeries that you've performed.
Sure. Well, in sticking with the hair topics.
Okay, all right. Well, that's to make the people comfortable. They give themselves more. You give them actually more confidence.
Absolutely.
Where they actually love themselves, thanks to you.
There you go.
You make them feel good and everything else, and it's really wonderful.
We could take, for example, somebody who may have had some scarring to the top of their forehead. Or maybe they were just born with a high hairline and they don't like it. I wrote a paper several years ago I was actually the first person to write a paper on this particular surgery called a hairline lowering surgery. So again, it can be used for people with traumatic scars to the forehead or really for any reason. I can show you just a representative example of somebody with a high forehead. And we can take, for example, let's say maybe she had a scar that was coming across right here, whether it was traumatic from surgery,
Yeah, okay.
cancer, any reason for someone to have a scar on the forehead. They're a very common area to get hit. It's just it's an open area.
Okay.
So someone like this could have the procedure called a hairline lowering. And if I can show you sort of the after effects here of doing that kind of procedure, this is what we find. So we can usually lower the hairline up to 2 centimeters, sometimes longer, 3 or 4 centimeters.
Okay, and a centimeter in inches is how?
Oh, I believe 2.5 centimeters is an inch. Don't quote me on that.
Okay, all right, because I come from the old inch measurements.
Right, absolutely. Most of the surgical measurements are in centimeters, but again, I think an inch is about 2.5 centimeters.
Yeah, all right, okay.
So, this individual was lowered about let's say a little less than an inch.
Okay.
And if she had had a scar there, it would have been completely erased.
Yeah, wonderful.
It can be done either with hair transplantation or scalp flap, which is this hairline lowering procedure.
Yeah, wonderful. Isn't that wonderful?
And again, I wrote a pretty extensive paper on this, and a lot of surgeons are now using this technique.
Yeah.
It's been featured on different TV shows, and your viewers can look at the website and get more information.
Yeah. Oh, tell them what your website is. Tell them what your website is.
You would just go to hairrestorationofnewyork.com. That's my new website on hair restoration.
Yeah.
And I also have another website, www.drendy.com.
Yeah. All right, and that could be before surgery, after surgery, whether the person has surgery and needs it, or whether the person just wants it for cosmetic reasons without surgery and stuff like that. You have performed over 7,500 surgical procedures. Can you give us, some ideas on what those procedures were?
Sure. Well, I think you can see I'm most passionate about hair restoration.
Okay, I know you are, yeah.
But I do all kinds of procedures on the face and the scalp.
Yeah.
I really don't venture down below the neck.
Okay.
Really super specialized just for one area.
All right.
So, for example, the hairline lowering, the hair transplant procedures, brow lifting procedures, facelifting procedures, anything on the nose, on the lips, laser resurfacing, and fat injections. We do fat injections to the folds or to build up the cheeks or different areas in the face. I also do other types of injections, some of the temporary fillers that are on the market to fill in areas, and then some of the things that erase wrinkles. So.
I see. Oh, that's wonderful. That's wonderful. My. And you've been doing this now for how many years?
I graduated medical school in 2002, and I've been doing surgery ever since then.
Yeah.
I did my residency in Philadelphia and then went out to San Francisco to work with some of the pioneers that developed some of these techniques in hair restoration and facial plastic surgery.
Wow. And now you're even teaching them.
Absolutely.
which is really wonderful.
And I teach some of the students who are going through training on these things, as well as doctors who are in practice come to watch me do these procedures all the time.
Wow, isn't that wonderful? Isn't that wonderful? And you've also been rated in the top surgeons list from 2007 to 2012, throughout, which is really wonderful. How many procedures now are you doing, and what kinds of procedures are they? Currently?
Well, I do, like I said, I do a lot of hair restoration procedures, a lot of facelifting procedures, rhinoplasties. Today I did 3 procedures, a hairline lowering, a rhinoplasty. These are my staples. This is what I do quite a bit of.
Okay, tell the audience what a rhinoplasty is.
Well, rhinoplasty is really any surgery that's done to change what the nose looks like. So that can be done for patients who don't like the way their nose looks, patients who have had trauma to the nose that not only distorts it but also affects their breathing. So if you're having trouble breathing after a nasal trauma, you can get that fixed in most instances, and at the same time a lot of patients will change the shape of their nose. So these procedures vary a lot. No 2 noses are the same, so there's a lot of variability in it, and it takes a lot of experience and a sense of artistry to get a nose looking good.
All right, now a lot of singers are afraid that if they change the shape of their nose, they won't be able to sing anymore. Is that true or false? Or I mean, what is that?
I've heard that before too. You think about the nasal resonance of someone's voice when they're singing, and certainly if you change the dynamics of the airflow through the nose, conceivably that could happen.
Yeah.
So, it's something that we talk about before we do the surgery.
I-
Does it happen on everybody? No, of course not.
Yeah.
But could it happen? Absolutely.
Yeah, yeah. Is there a bone in there, or is it just cartilage? What is inside the nose there that would cause that?
You talking about for the change in voice, or?
Well, the change in voice and the change in the shape of the nose. I mean, because I know a lot of people out there are very interested in maybe changing the size of their nose, and
Right.
some is a big one. Some. Did you ever have someone that had a small nose that wanted to make it bigger?
Absolutely. I mean, not only did maybe they were born with a small nose, or maybe someone did a surgery to reduce the size of their nose and it became too small and they wanted it built up again.
Yeah.
These are common things. You seem like that you would think that was a unique case.
Yeah.
But, these kind of things happen all the time.
Yeah.
We can build noses back up using different things, like we can use ear cartilage to build the nose back up.
Yeah.
We can use cartilage from the person's ribs
Yeah.
to build the nose back up.
Yeah. All right. But the thing is, there isn't a bone. It's just cartilage. Is that what you're telling me?
In the nose, there's different parts. The upper part of the nose does contain the nasal bone.
Yeah.
And there's a septum that goes down the middle of the nose that's made of both bone and cartilage.
Yeah.
There are other areas of cartilage on the sides of the nose, and each of those can be manipulated and reshaped and carved to look aesthetically pleasing.
Oh, it's wonderful. And then how long does that take to heal? Or, I mean, as far as, I don't quite understand because when there's singers out there, there's a voice box, and the singers sing through their voice box, but they have to hear the buzzing in the nose in order to place the tones correctly, to be in pitch and everything else.
Right.
And would that operation on the nose, would that affect the ringing or the buzzing in the nose? Would you,
It certainly could. I don't want to, tell your audience that I'm an expert in laryngology. That's the study of voice.
Okay.
Basically, there are doctors that specialize just in the voice.
Okay.
But I do have some background in it. And just to answer your question, if you change the dynamics of the airflow through the nose, there are different nasal resonance after that. And
Resonance, that's correct.
yeah, exactly.
Good.
So it can actually change the voice, and sometimes it's minor to the point where you wouldn't even notice it, and other times it can be a little more noticeable.
Yeah, yeah, very good. Before we close the show, I'd like to find out when you decided that you wanted to be a doctor, and how did you go about doing it?
Well, I was born in a family where my father and my uncle were both doctors, but they, I saw what they did, and I always wanted to be a surgeon. So I went through the training in medical school. Then I got mostly interested in head and neck surgery. So I followed a career path to learn basically everything on the head and neck. I really focused on that area. My favorite part about that was the plastic surgery and the reconstruction. Plus, I was really good at it. So,
no, you're wonderful. You're absolutely, my God, you're teaching other doctors. You're absolutely fabulous.
Right. So I went on to do the training in San Francisco with the people I mentioned before, which was really an excellent experience. And now I'm here back in Manhattan doing these procedures and training other people on how to do them.
Yeah, and making people happy.
Absolutely. That's the best part about the job, is seeing the results and how natural they are, and seeing how happy people are about it afterwards.
That's wonderful. That's really, really wonderful. That's wonderful. We have to wind up the show shortly. We don't have too much time. Gee whiz, what else can you possibly tell our audience, as far as where they can find you and stuff like this again, and phone number and the website, and
well, as I said, I'm in Manhattan.
Yeah.
My new website is www.hairrestorationofnewyork.com. There's a lot of information on there about hair restoration techniques that we discussed today, and a lot more than that, of course.
I know a lot more than that, of course.
And you can see my phone number up there on the screen. And then there's just another website, www.drendy.com, that talks about all the different facial plastic surgery and reconstructive techniques, as well as the hair transplant.
Yeah, that's wonderful. That's really fabulous. So if anyone out there, needs help with anything after surgery, after any kind of trauma, any kind of accidents, muggings like we have in New York City. You know, I mean, this is really the doctor, you know, to really get in touch with for any kind of information. Dr. Kevin Endy is absolutely wonderful, and he's very compassionate, and he's a wonderful gentleman as well. And I'm sure you're going to be extremely happy. And we're still running as far as time goes, and and let's just get a little more in
Sure.
as far as what else can you tell us about any other surgeries and any other things before the show really fades out?
I can show some more examples of hair restoration. You know, we can take a gentleman that has basically very little hair on the top of his head here,
Yeah.
and in one surgery, get him looking like this.
Oh, wow.
And this is after 1 year.
Yeah.
You know, like I said, it doesn't grow in right away, but when it does grow in, the results look
Yeah.
very, very natural.
Well, how long? Well, this is after 1 year?
This is actually, this picture is after 8 months, but
Oh.
he looks even better now.
Yeah.
So
Yeah.
we have some other examples too
Yeah.
of another hairline lowering procedure here.
Yeah. Yeah.
And obviously someone with a very big forehead.
Yeah.
And a
And that's,
picture of her
isn't that
afterwards.
fabulous? Oh, that really is fabulous. That
Let's see
really
what
is
it's-
wonderful.
So you can see
yeah.
how much of a difference there is.
Yeah, that's really fabulous.
All these patients were extremely happy with
Yeah.
their procedures, and it's
Yeah.
great to see
Yeah.
how happy they
Well,
are afterwards.
it's certainly great to have you on this show, and it is the Josiane Show. And Josiane, I want to thank you very much for having Dr. Kevin Endy, and of course having myself as sitting in for you. So until the next time, ladies and gentlemen, please stay tuned for the next show, the Josiane Show, People of Interest.